Hello and welcome to my YouTube channel. Today I will be discussing the topic of apoptosis. So, what is apoptosis? Apoptosis is a type of programmed cell death. It is also known as cell suicide. Going to the definition of apoptosis, apoptosis is a cell death pathway which is induced by tightly regulated intracellular program in which cells which are destined to die activate certain enzymes which degrade the cell's nuclear DNA and cytoplasmic proteins. So understand this. You don't have to mug up the definition. Try to understand. It's actually a cell death pathway which is tightly regulated intracellular program in which those cells die which are destined to die because of certain enzymes which degrades the cell, the nuclear DNA and the cytoplasmic proteins of the cell is degraded in this procedure. So as I have told you, it's a type of programmed cell death and it is energy dependent. What does that mean? It means there is utilization of ATP during this apoptosis. Coming to the causes of apoptosis. Apoptosis could be because of physiological causes or pathological causes. I have enumerated few pathological causes here. As you can see, during embryonic development, there is organogenesis. Organs are developed when an embryo is inside the uterus of a pregnant female. For example, this hand. The hand initially in embryo is like a block. There is no separation between the fingers. So how does these fingers separate? That is because of apoptosis. The cells between the fingers die and there is separation of the fingers, and this is the phenomenon how the hand is scarred. Another example of apoptosis is hormonal induced tissue atrophy. As I've already told you in my previous lecture that the pregnant uterus undergoes increase in size because of cellular hypertrophy and hyperplasia. But after pregnancy is over, when the delivery is done, how does that uterus regress in size? That is because of apoptosis. Another example of hormonal induced atrophy is in lactating breast. The lactating breast after the withdrawal of breastfeeding reduces in size because of cellular apoptosis. Another physiological cause of apoptosis is seen when the cells which have completed their function dies. For example, RBC. You all know the lifespan of RBC is 120 days. And after the completion of that 120 days, the RBC dies because of apoptosis. So here there are few physiological causes of apoptosis. Coming to the pathological conditions where apoptosis is noted. You can remember a few of them. I will enumerate that for you. You can note apoptosis when there is acute myocardial infarction. There, the cardiac myocytes could die because of apoptosis. When there is orchidectomy, after that, prostate atrophies. Here also, the underlying phenomenon is apoptosis. Another example is after transplant rejection, there is cell death of cytotoxic T cells due to apoptosis. In viral hepatitis, there is formation of Councilman bodies because of the phenomenon of apoptosis. In HIV infection, you know there is progressive depletion of CD4 cells, and that is also because of apoptosis. Also, apoptosis is noted in the degenerative diseases of CNS, for example, Alzheimer's disease. And also, when certain tumors are exposed to chemotherapeutic drugs, there is cell death because of apoptosis. So, you can understand here a few pathological causes of apoptosis as I have shown here in this slide. Coming to the mechanism of apoptosis. Well, there are two pathways of apoptosis. One is an extrinsic pathway and another is an intrinsic pathway. So, in the extrinsic pathway, the apoptosis begins when the death signal is originating from outside of the cell. For example, the natural killer lymphocytes or CD8 positive cytotoxic T lymphocytes. Here, when the signal is coming from outside the cell. Whereas in intrinsic pathway, the intrinsic pathway is triggered when there is internal stress. This internal stress could be because of DNA damage, hypoxia, or oncogenes. Both the intrinsic and the extrinsic pathway have two phases. One is the initiation phase and the other is execution phase. So let's talk about these pathways. Give you an overview of intrinsic pathway. As you can see in this slide, two set of proteins, the pro-apoptotic proteins and the anti-apoptotic proteins. Anti-apoptotic proteins are BCL2 and BCL-XL, and the pro-apoptotic proteins are BAX and BAC. So, whenever there is disbalance between these proteins, then, for example, when the BCL2 and BCL-XL are blocked and there is activation of BAX and BAC, there is the phenomenon of apoptosis. And what happens here? As you can see here, this is the picture of the mitochondria, and in the mitochondria you can see there is an enzyme cytochrome C. This enzyme is located between the inner and the outer membrane of mitochondria. The anti-apoptotic BCL2 and BCL-XL does not allow this cytochrome C to leak from the mitochondria into the cytoplasm. However, whenever there is a stress factor, intrinsic stress factor, there is activation of BH3 proteins which activates BAX and BAC, which are pro-apoptotic, and inhibits BCL2 and BCL-XL, which are anti-apoptotic. And this causes increase in the membrane permeability of the mitochondria, and there is leakage of the cytochrome C. This leaked cytochrome C will activate the caspases, which will lead to cell death. I will elaborate this phenomenon in further slides. And as I have told you, the other pathway is the extrinsic pathway. In extrinsic pathway, as I have already told you, that the stress lies outside the cell. So in this, from outside, as you can see here, there is a fast ligand and there is a fast receptor. So the fast ligand comes and binds to the fast receptor and causes initiation of the caspases. Here the initiator caspase is caspase 8, which gets activated, and it will further lead to cell death. Again, as you can see here in the diagram, there is another ligand, which is TNF alpha ligand, that binds to the TNF receptor, and that also causes activation of initiator caspases. In extrinsic pathway, there is another phenomenon. There is activation of cytotoxic T cells. When these cytotoxic T cells comes and act on the target cells, they release granzyme B, which causes another pathway activation, and that also leads to activation of the caspases, which will lead to cell death. Both intrinsic, extrinsic and granzyme pathway I will tell you in details in further slides. This was just a brief overview. Coming to the intrinsic pathway, it is also known as mitochondrial pathway. Remember that intrinsic pathway is the mitochondrial pathway. So as I've already told you, here the stress is coming from inside. Okay, and what could be those stress factors? It could be loss of stimulatory growth factors or DNA damage that is causing the cell injury. And as I have told you, there are anti-apoptotic proteins and there are pro-apoptotic proteins. So the intrinsic pathway is mediated by the changes in the level of anti-apoptotic and pro-apoptotic proteins. As I've already told you that BCL2 binds to the cytochrome C and prevents the apoptosis and inhibits APAF or APAF1. I will be telling you about APAF1 in the further slide. However, the pro-apoptotic factors, which are BAX and BAC, they leads to increased mitochondrial permeability and release of cytochrome C, which activates APAF1 and procaspase 9 and cause formation of apoptosome, which activates the caspase 9. Here in the picture, as you can see, in the intrinsic pathway, because of DNA damage, hypoxia or any kind of metabolic stress, there is activation of BH3 proteins which activate the pro-apoptotic factors BAX and BAC. And what will this BAX and BAC do? They will alter the permeability of the mitochondrial membrane and cause the release of cytochrome C. This cytochrome C goes and combines with the APAF1 and causes formation of apoptosome, and this apoptosome causes activation of caspase 9. All this comes under the initiation phase. The initiation phase of the intrinsic pathway from the release of cytochrome C to the activation of caspase 9 is the initiation phase of intrinsic path. After the initiation phase, there is a execution phase. So what happens in the execution phase? This activated caspase 9 goes and activate caspase 3 and caspase 7. And these caspase 3 and 7 causes nuclear DNA degradation and degradation of the cytoskeletal proteins, which leads to apoptosis. So this was about the intrinsic pathway. Let's talk about the extrinsic pathway now. So what happens in the extrinsic pathway? Well, there are death signals from outside the cells which causes the trigger of extrinsic pathway. In this, there is a fast ligand which comes and binds with the fast death receptor. The fast death receptor is also referred to as CD95. This CD95 mediates a cascade of caspase 8 activation via fast associated death domain containing adapter protein. I will be discussing this further in the next slide, where I will be showing to you how it happens. Another pathway is a perforin granzyme pathway. What happens in perforin granzyme pathway? In perforin granzyme pathway, the cytotoxic T cells are also able to exert their cytotoxic effects on tumor cells and virus-infected cells via another pathway which involves secretion of transmembrane pore-forming molecule perforin, which causes release of cytoplasmic granules through the pore into the target cell, which are granzymes. And this granzymes activates another initiator caspase, which is caspase 10, which will further lead to activation of the executioner caspases and cause apoptosis. To simplify this, as you can see in this diagram, here you can note the fast ligand. I have described it as fast L. As you can see here, this fast ligand is coming and binding with the fast receptor. And this fast ligand, fast receptor combination, multiple of them are going and activating this fast associated death domain. They are combining with it and it is getting activated. And what it will cause? It will cause conversion of procaspase 8 to procaspase 8 is converted to caspase, activated caspase 8. So in the extrinsic pathway, as you can see, there is binding of the fast ligand to the fast receptor, and multiple fast ligand, fast receptor comes and bite with this death domain, which is also known as FADD. This causes conversion of procaspase 8 into caspase 8, and this caspase 8 is the initiator caspase in extrinsic pathway. And what will happen after that? There will be an execution phase, and the caspase 8 will go and cause activation of caspase 3 and caspase 7, which will ultimately lead to apoptosis. So here what you should remember, in intrinsic pathway, which is the initiator caspase, it is caspase 9. And in extrinsic pathway, the initiator caspase is caspase 8. And what are the executional caspases? They are 3 and 7. And what happens when the executional caspases are activated? They cause breakdown of nuclear DNA and cytoskeletal proteins, which leads to apoptosis. So as I've already told you about extrinsic pathway, that in extrinsic pathway there is fast ligand binding to fast death receptor, which causes activation via fast associated death domain containing adapter protein of caspases 8, which leads to further apoptosis. Here another diagram to show you this receptor ligand binding. Again, you can see here fast ligand is binding to the fast receptor, and multiple fast ligand fast receptor are activating the FADD or FAD to conversion of procaspase 8 to caspase 8, which will further lead to apoptosis by executional phase. And as I've already told you about the perforin granzyme pathway, again I will be highlighting the cytotoxic T cells exert their cytotoxic effects on the tumor cells or the virus infected cells via this path. Phosphatidylserine and opsonins present on those cells which are recognized by the phagocytes, and they go and phagocytes those cells. So there is phagocytosis in apoptosis. It is a very important feature of apoptosis, which is phagocytosis. Another very important feature which differentiates the apoptosis with necrosis is there is no inflammation in apoptosis. And why there is no inflammation in apoptosis? Because the cell membrane here is intact. It is not distorted or it is not broken, so the cell's content is not leaking outside, which could lead to an inflammatory response. So there is no inflammation in apoptosis. Let's revise it. In apoptosis, there is elimination of unwanted cells. It is a type of programmed cell death. What are the changes? First, the cell will shrink, there will be nuclear fragmentation, there will be formation of bleb, there will be formation of apoptotic bodies, and there will be phagocytosis of apoptotic bodies. So how does the apoptotic cell look? This is an H&E stained picture for apoptotic cell, and as you can see in the big arrow, it's depicting that apoptotic cell, and you can note here the intensely eosinophilic cytoplasm, and there are dense purple nuclear fragments. So this is how a apoptotic cell looks. Coming to the end of this session, I would like to emphasize on some key features of apoptosis. Always remember that apoptosis is a type of programmed cell death. That means that the cell has decided to die. This cell death is energy dependent. There will be consumption of ATP during this procedure. Also, apoptosis could be because of physiological reasons and pathological reasons, which I have already told you. There are two pathways for apoptosis. One is the intrinsic pathway and the other is extrinsic pathway. In the intrinsic pathway, there is activation of caspase 9, and in the extrinsic pathway, there is activation of caspase 8. And in the execution phase, there is activation of caspase 3 and 7. And what does that cause? It causes the nuclear fragmentation and the DNA is breakdown, and after that there is also cytoskeletal breakdown, and because of all these there is apoptosis. What are the features of apoptosis? The initial feature is shell size is shrinked. The cell is reduced in size, or there is shrinkage of the cell. After that, there is nuclear condensation, there is nuclear fragmentation, there is formation of membrane blebs, and then there is a formation of apoptotic bodies. One hallmark is there will be presence of phagocytosis. Apoptosis, there is presence of phagocytosis. The phagocytes will identify the cells, apoptotic cells, and they will do phagocytosis, and there is no inflammation, there is lack of inflammation because the membrane is intact, there is no leakage, so there is no inflammation. So I have emphasized on all the features which are essential for you to know for apoptosis now, and I assume that you have understood the lecture. Go back and refer to your books. Try to understand this topic. It's a very complex topic, but it's a very important topic for your exam, your reference books, whatever reference books you are reading. And then again come and watch the video, and I am sure that this video is going to help you understand the basic concepts of apoptosis. Hope it was a useful video for you guys. See you in the next video. Take good care of yourself, and until the next video, bye-bye.